So my interest in CPath started in early 2022 when Biogen made the decision to expand into rare diseases. So I emailed Lindsay Murray, and she responded right away. And we got to talking about the potential mutual benefits of Biogen being an industry partner with CPath, largely in terms of the opportunity to engage with partner industry and with partner regulators in our efforts to develop clinical outcome assessments in rare disease. So that's such a great question, and it's pre-competitive partnerships among industry seems like an oxymoron. But the fact is we all have the same vision, which is to develop therapeutics in these really hard rare diseases where clinical outcome assessments are really challenging to develop. What Critical Path does is bring the industry together in the same room, and we engage regulators and we enrich and bring each other up in terms of trying to do what's best for these patients and what's the best way to develop a therapeutic, and to develop a clinical outcome assessment that's realistic and that it helps us align with regulators and with each other so that we're all achieving the same goals. CPath arranges the fora, the agendas, and invites the regulators and puts them in the same room with the industry partners. So we ask each other questions, and it's an incredibly enriching experience. As industry partners, we sit there and learn that the FDA and the EMA they're human beings, and they themselves have limited resources. And that is, the industry can challenge regulators and vice versa in the same room. Critical Path is in and of themselves, they are also a rich body of knowledge, and they are very adept in bringing these parties together and to having a very productive meeting. So safety is of the utmost importance, right? So what industry's responsibility is to have the appropriate preclinical modeling, preclinical clinical pharmacology, understand the safety of, as for instance, gene therapies. They are not the miracle cure that everybody thought 30 years ago, because it's very challenging to introduce these in a safe way in, let's say, AAV capsids. So the industry has to get there. Now where Critical Path comes in is on the efficacy side. So when you look at these genetic disorders and look at the heterogeneity of the phenotypes, and how are we going to measure this clinical outcome in a 6-month-old versus a 2-year-old versus a 10-year-old in all these different stages of development, because they do develop, but the clinical outcomes are going to vary according to the phenotype. So that's where Critical Path helps bring together regulators and industry so that we can align on the efficacy side. To have the regulators in the same room with industry, with Critical Path, so that we're all aligned and we don't have to answer these hard questions in silos.